Thanks, Ben. Good morning, everybody, and welcome to Blackpool. So we are Blackpool Researching Together, and we're just going to talk today about the experience in Blackpool of collaborating across different parts of the NIHR infrastructure and local partners, and how valuable it is to have dedicated infrastructure within Blackpool to leverage the resource and capacity building opportunities into the area. So I'm here today. My name is Niamh McMahon. I'm a research fellow at Lancaster University. As I like to say, I'm on loan to Blackpool Council to support the HDRC. And I'm here with our fantastic co-researchers, people who've previously been co-researchers with us, Lauren, Matthew, and Blue. And we're going to talk about some of the projects that are going on. So some people may know about the HDRCs, but very quickly, the background to this is that we are small teams embedded within local government, and our job is to boost research capacity and capability within that setting. We're there to try and support an evidence-informed culture, to try and shift culture, or to build on what already exists. We're there to mobilise knowledge, especially on the wider determinants of health, and that's the importance of shifting resources from the NHS into local government and social care settings, so that we can address the health inequalities that have already been discussed. And we're also there to carry out research collaboratively where there's a need. Blackpool is a Wave 1 HDRC, so we've been going since September 22, and we know that we will exist in our current form until December 28. But as you know, we've got local government reorganisation coming down the line, so things will maybe look a little bit different after then. Every HDRC has a different model, but our USP, our unique selling point in Blackpool, is employing local residents to work as part of the HDRC team. We've heard a lot about the challenges today. We know that fresh thinking is needed. We need to start asking different questions, and we need different people to be at the table, shaping the agenda and holding our institutions to account for the actions that are taken on improving health and reducing health inequalities, and that's what we're really trying to do in Blackpool. There's so many things that we could talk about. There's a lot of work we're doing internally to build up and offer support for the council, but really today we just wanted to give you a selection of examples of collaborative working across the NIHR infrastructure. And we're going to start with an NIHR Applied Research Collaboration example. So Lauren is a co-researcher with us, was a co-researcher with us at Blackpool Researching Together, and has recently gone on to undertake an ARC internship, and she's going to tell us about the really interesting work that she's doing as part of that.
Thank you. Hi, everyone. So, yeah, I'm Lauren. I'm the co-research and engagement lead for Boing Boing Foundation. I'm also a freelance dance artist. So I'm currently still undertaking this research project, which has been exploring artists' relationships with research in Lancashire, looking at their perceptions, their experiences, and their access to research. And the aim of this project has really been to strengthen artist and researcher collaborations. And I'm really here from artist side on what they think about research, because we know that doing things creatively can help in data generation and in dissemination. So I want to pose a question to you all, which is, what comes to mind when considering artist involvement in health research? Now, like I just said, this could be, your immediate thoughts could be, oh, well, we could use some creativity, some artwork at the end to help with our dissemination of our research results, so that community members can better understand what's happened. It could be that you think that creativity could be used in data generation to get different experiences through different creative methods that may not come out in things like interviews. And these are really valuable ways of involving artists in research. But what I want to pose as something to think about today is that artists are already researchers. So, artists have to, something that's come up a lot so I've been doing interviews. Should have said that at the beginning, but yeah, I've been doing interviews in this project, and something that's come up is that artists are constantly having to evidence their work to prove that it's valuable, for one, and to get funding. And also there's obviously an element of like wanting to improve the work for themselves and the communities they work with. So I just want to really you to consider that if we think of artists as researchers themselves, how that could open up opportunities for different types of collaborations with health researchers, and how that might change health research projects. So yeah, that's what I've been working on. So I've done 10 interviews, and I'm about to do a focus group. So yeah, thank you. I'm going to pass over to you.
Thank you, Lauren. We're really looking forward to hearing about the results of that. So we've also had work, collaborations with the NIHR School for Public Health Research, with Matt is going to talk us through now.
I'm very unprepared and have got the slides in the wrong order and already lost my name badge. So we are doing very, very well this morning. So for the Household Support Fund, it's an analysis, I suppose, of it's basically like a service evaluation about how that's actually been helping food insecure families. So it's across 4 areas. So it's Liverpool, Blackpool, Knowsley and Manchester. And the collaboration came from Kat Jackson from Liverpool University, since she was able to actually secure the funding through the School of Public Health Research. From there, though, that she actually reached out to Blackpool HDRC to locate some co-researchers to work on the project as public advisors. So it uses a mixed method approach, because obviously there's a bit of quantitative data on uptake, but also qualitative interviews based on people's experiences of the process. So the work has actually been undertaken by the public advisors and the co-research, which I am on the project. So that's including like assisting with like local connections. So she's going to the Blackpool Together meetings now that are monthly. But part of that obviously has been able to link her in with all these different connections and different people from various sectors. So on top of that, we're going to have some data analysis in the coming months and some exhibition of the creative works that have been made. And I guess the outputs of the evaluation obviously is to help with how we're actually intending to assist the next stage of the Household Support Fund, which is obviously now turning into Crisis Resilience Fund. So we're quite hopeful that that's going to have a positive impact on the policy in general as well.
Thank you, Matt. And then we also have an example of work that we've been doing with the NIHR Public Health Intervention Response Studies team, which people may know as the FIRST team.
Yes, so the FIRST team actually came to Blackpool, first off, because the Cosy Homes in Lancashire scheme was also a service evaluation. And we are one of the highest applicants for that scheme, so we are the second highest, if I remember. But interestingly, we also are the lowest for uptake on the scheme. So if I remember off the top of my head, so don't quote me, the report's coming out, but it was, we had, I think, a 60% success rate, which is quite significantly low for uptake on the programme. So part of that, though, was that they wanted to embed people with lived experience of the particular issue of, regarding like heating homes and difficulties with that, but also to actually help guide and support with the local context, because obviously we have a high private rented sector and all those sort of difficulties as well. So the work undertaken was over a substantial period, so it's just been over 2 years as of now, and our co-researchers are involved in the early planning, interviewing, data analysis, data collection, and all various stages. At the moment, obviously, we're in the final stages of finishing the report up. It's just got a few little tweaks left, and we're in the final stages of an academic paper as well. But our co-researchers obviously have actually reflected quite a positive experience of the project. So we've already had a policy change regarding the Hug 2 scheme, as well as the co-produced elements of the project, because they felt like they actually were being listened to. There was a bit of imposter syndrome at the start for some of them, but now they are very confident in challenging everyone, which is always wonderful. And, it's just about how we've been able to assist with those like potential focuses on certain findings. And I guess it's been a bit difficult because what people from the community are viewing as the important part of it compared to what academics or the individuals who actually run the scheme think are the most important parts. But all of them are quite valid and interesting at the same time. So I'm going to pass over to Blue now, who is our peer researcher and our lead researcher on the Street Life project.
So, first of all, I just want to say Street Life is a charity that supports young people who are 16 to 25, who are either homeless or in any sort of need. So, getting onto the project now for you, so just over 13 months ago, I had the privilege of meeting the lovely Matt.
No privilege.
During a NIHR Research and Champion Training Programme, which was very intense, and it's been a very long journey since then, yet to say. So, for the past 13 months since that programme finished, we've been working together doing multiple different workshops over the past year and a bit to build a research question, where we were doing all sorts from finding out what goes into a research question and many other topics and the ethics behind it and the literature. So we've been, over the past month or so, been working on an application for seed funding, which I'm happy to say has finally gone in and went in on time, which I'm shocked about. But it's brought so many young people together on this project, and we've also had time to figure out what's going on. There's been lived experience, people that have come from Matt's team that have helped out, and to say this project has come so far, but there's still yet so much more to do.
Thank you, Blue. And we're around for the day, so if anybody has any questions about these projects, please do come and chat to us. We're happy to tell you more.